Hi, everyone. Welcome to another video lesson. Today, we're going to talk about basic first aid and safety. It's time to get health smart. Basic first aid. Safety doesn't happen by accident. Have you ever been in a situation that required first aid? Feel free to pause the video now for discussion. What is first aid? First aid is immediate care given to someone who becomes injured or ill until regular medical care can be provided. The goal of first aid is to prevent further injury or even speed recovering by knowing what to do in an emergency. Knowing what not to do in an emergency is equally as important. Minor emergencies. Some injuries are not life-threatening. Examples would be cutting your fingertip and it's bleeding, falling and scraping your knees while skateboarding. These injuries can be cleaned with soap and water and wrapped or covered with a breathable bandage. Other minor injuries include insect stings and sunburn. Major emergencies. Some emergencies can be life-threatening. Someone has stopped breathing, someone is choking, someone has ingested poison, or they become severely burned. These situations require immediate help. Check the scene and the victim. Call 911 and care for the person until help arrives. First aid for insect bites. Remove the stinger by scraping it off with a firm, straight edge object. Do not use tweezers. Wash the site thoroughly with mild soap and water. Apply ice, wrapped in a cloth, to the site for 10 minutes to reduce pain and swelling. Continue to apply ice alternating for 10 minutes on and 10 minutes off. If an allergic person has gotten stung, seek medical help immediately. First aid for sunburn. Take a cool bath or shower and apply a clean towel dampened with cool water. Apply an aloe vera moisturizing lotion multiple times a day. Leave blisters intact to speed healing and avoid infection. Talk to your doctor if the pain increases. First aid for scrapes. Stop the bleeding by applying gentle pressure with a sterile bandage or clean cloth. Clean the wound by rinsing it with clean water. Apply a thin layer of antibiotic cream or ointment to the wound. Cover the wound with an adhesive bandage or sterile gauze as it heals. Change the wound covering twice a day to keep the wound clean. First aid for bruises and sprains. A bruise is when an impact breaks blood vessels below the surface of the skin. A sprain is when ligaments that hold joints in position are stretched or torn. A doctor should always evaluate serious sprains. Minor strains can be treated using the Price method. Protect the injured area by keeping it still. Rest the affected joint for 24 to 48 hours. Ice the injured area to reduce pain and swelling. Remove the ice every 15 to 20 minutes. Compress the injured area by wrapping it in an elastic bandage. Elevate the injured area above the heart to reduce swelling. Application. First aid charades. Students will be divided into teams. Each team will take turns acting out a common injury. The first team to correctly guess the common first aid injury and describe how to treat it gets a point. The team with the most points wins. Pause the video now to play first aid charades. Exit ticket for today. Why is it important to know basic first aid safety? That's it for today, everybody. You are now officially Health Smart. See you next time.